need something?
Rudy needs a barrel.
Straight across. I mean, out in the hall.
Yeah, right.
In front of you. To your right, to your right.
Yeah.
I was looking at it. Is it pulling cable?
Put some spikes on it.
So James, you know, we have something at 3:45.
No, in here?
No, somewhere else. He's sending it to us. He said we have to stay late. That was from Joe Feeney.
What is the 3:45?
Yeah, there's a photo op at SH73.
What time? 3:45, you said.
It's at 4:15 is the event, so he says we have to stay.
Oh, really?
Yeah, he's like, I'm gonna need you to stay. You should have, you should do a plug in right there. Oh, yeah. See, plug it up. They give it to you in case, you know, in case you want to plug it too. There's mics built into them. I'm not hearing it. Are you hearing it? Hello, Rudy. Check 1 2. Do you hear this? Check 1 2 3 4 5 6 7 8 9 10. Now you do? Cool.
Yeah, and then we're going to the Alliance for the years we had in the past. We've been going there most summers, except we skipped it last year.
Also,
We kept going.
my feet have gotten a little longer. I don't know if March, April, or whatever it is. But I've gone from a 13 to a 13
Yeah.
count, which means now that I have to buy horses.
Yeah, they're a good travel agent. Very good thing.
Oh no, I'm sure that's what happened to me.
We got one farm. We have discovered that when you take away my son's
Heads up.
iPhone, he's a far better job. Like his dad's very good. Reads the commentaries. He's going through this 50-year-old volume of Sherlock Holmes books that I have.
Heads up. Yeah, they said they're coming in just a second. Oh.
Yeah, right.
Sorry, they said they were coming in.
Okay, good afternoon, everyone. I'm proud to be joined by my comrades in arms, Senator Murray of the Help Committee and Senator Wyden of the Finance Committee. So, this morning, Senate Republicans introduced their new version of Trumpcare. The meat of this bill is exactly the same as it was before, and in some ways, they've somehow managed to make it even worse. The bill still sends out-of-pocket costs for the average American soaring. It takes a sledgehammer to Medicaid. These cuts are every bit as draconian as they were in the previous Trumpcare bill. It still defunds Planned Parenthood. It still has the age tax that could force Americans in their 60s to pay tens of thousands of dollars more for their health care than they do today. It still forces Americans to pay more for less care. The fundamental reasons that Americans didn't like Trumpcare 1 means they'll like Trumpcare 2 even less. They've made some changes to the bill. It's important for the American people to understand what they do. First, the new Cruz Amendment is a dangerous bait and switch that will lead to junk insurance plans that no American would want. The Cruz Amendment will leave millions of Americans with pre-existing conditions out in the cold. There'll be virtually no real insurance for them. And don't take it from me. Take it from the AARP, the Cancer Action Network, the American Heart Association, and others. These groups, non-political, non-partisan, simply representing American patients and citizens, say that the Cruz Amendment would, quote, limit enrollment, reduce benefits, create waiting lists, raise premiums, and out-of-pocket costs to the point of unaffordability. Senator Grassley, as mainstream a Republican from mainstream America as there is, Senator Grassley said it would annihilate the pre-existing condition requirement. Second, on taxes. Republicans are going to try to tell the American people that this bill is no longer a tax giveaway to the wealthy and special interests. Unfortunately, that just isn't true. This bill still cuts taxes on pharmaceutical companies. It still cuts taxes on health insurance companies. And by expanding health savings accounts, they've created a new tax break that goes disproportionately to the wealthy in this country. Let's face it, if you have enough money to pay, if you have enough money to put aside in a health savings account, you have enough money to pay premiums. The problem is Americans can't afford premiums, and the Americans who can't afford premiums will not be able to afford health savings accounts. Third, the changes on opioids adds a measly $45 billion to combat the opioid epidemic while slashing $770 billion in Medicaid funding, which is how most of the opioid epidemic is funded. It's an insult to every family that has suffered a loss from a loved one who died of an overdose. $45 billion is a drop in the bucket as to what it will take to combat opioid abuse in this country. Adding $45 billion in opioid funding is about buying Republican votes, not about saving young lives. The bottom line is this: the core of this bill is just as rotten as it was before. This bill, like the old one, means out-of-pocket and deductible costs will soar. This bill, like the old one, is a huge blow to families with loved ones in nursing homes who rely on Medicaid, and to parents whose kids are alive because of Medicaid. This bill, like the old one, means millions of Americans will lose coverage. The bill was mean when it passed the House, it's mean when it was introduced in the Senate, and it's still mean today. Republicans should abandon this path, step back from the brink, and work with Democrats to improve health care instead of sabotaging it. We're waiting for them. Any Republican who votes to proceed on this bill next week will have to look constituents square in the eye and explain why. Why did they move forward on such severe cuts to Medicaid? Why did they cut taxes for special interests? Why did you send my out-of-pocket costs skyrocketing? It's no wonder Republicans don't want to go home and face their constituents. Senator Murray.
Well, if President Trump called the House bill mean in a rare moment of honesty, can you imagine what he is going to say about this new Senate bill? Senate Republicans started with a Trumpcare bill that was negotiated behind closed doors in a room of 13 men. And not surprisingly, it would have been devastating for patients, women, and families. When they finally released their bill, it was immediately rejected by people across the country. Democrats, Republicans, independents, millions of people stood up, said no to that awful bill. They said no to the increasing costs for their families and for seniors. They said no to putting insurance companies back in charge. They said no to cutting tens of millions of people off of their health insurance, and they said absolutely no to Trumpcare. In fact, one study came out showing it was the least popular bill in 3 decades, which shouldn't be surprising to anyone who actually looked at what's in it. So what did Republican leaders do in the face of large-scale popular rejection of their bill? What did Republican leaders do after Republican senator after Republican senator after Republican senator said they could not vote for it without massive changes to help more people? Well, they made their bill even worse, even meaner. They did nothing to address the concerns that even many Republicans, governors, senators, and many others had about the massive cuts to Medicaid that will be devastating to patients and states. They did nothing to truly address the defunding of Planned Parenthood and cutting off access of care to millions of women. They did nothing to truly address how this bill would devastate our efforts to combat the opioid crisis, despite trying to hide that fact by including a fund that one Republican governor said is like spitting in the ocean. And when it comes to affordability and putting insurance companies back in charge, Republican leaders not only didn't fix the problems, they made them a whole lot worse. They caved to the most extreme members of their caucus and included the Cruz-Lee provision that would put the insurance companies back in charge and let them sell junk plans that don't cover what people actually need. It would raise premiums for anyone who isn't perfectly healthy and young. It will tell anyone who has a pre-existing condition or who gets sick, tough luck, and it will send the healthcare market into a tailspin. This bill was awful without that provision, but this is truly appalling. And it's almost as if Leader McConnell wants to allow Ted Cruz to poison and tank this latest effort. So I can only hope that Republicans who have opposed this bill because it hurts their constituents will be honest with themselves and honest with their constituents and oppose this awful and mean bill. Now, I know many Republicans are still scrambling for alternatives because they realize how toxic Trumpcare is. We saw a new one from Senators Graham and Cassidy just hours ago, and Democrats have made it very clear, and I want to reiterate this. We are ready, as we always have been, to work with Republicans to repair the damage they have caused to health care and work to make health care more affordable, more accessible, and higher quality. They just need to finally stand up with people across the country, reject Trumpcare, and then we will be ready to get to work.
Good.
Thank you, Leader. And the Leader and Senator Murray have said it very well, and just had a lot of town hall meetings at home and heard the same thing we're hearing across the country, and that is Americans are not saying the McConnell health bill would be okay if you just delay the tax breaks for the fortunate few for a few months. And make no mistake about it, that is the Republican strategy. The Republican senators have said that. Now, in addition to this tax con, the Cruz proposal, as my colleagues have touched on, destroys the private health and care marketplace for our people. It sends the premiums skyrocketing and makes care unaffordable for anyone with a pre-existing condition. But make no mistake about it, taxpayers are going to get stuck with the astronomical costs of cleaning up the damage from the Cruz scheme. And in effect, the Republicans know that's going to happen because they're trying to buy additional votes by blowing this hole in the healthcare system and then shoveling taxpayer dollars into the hole. You see that in their proposal. As my colleagues have noted, the new version still makes massive cuts in Medicaid, the lifeline. The changes are cosmetic. We have already looked at those. And here's the message on opioids. On opioids, this puts a Band-Aid on a gaping wound that is the opioid epidemic. And it is not going to come close to meeting the needs that our colleagues say they're hearing about in their communities. Last 2 points. Across the country, doctors, patients, and healthcare experts have basically been shouting from the mountaintop that this is not the way to go on healthcare. The way to go, as the three of us have said now for many months, is to end this our way or the highway reconciliation scheme and go back to saying that our two committees are going to do what we've spent lots of years doing, which is working to find common ground with senators of both political parties who have common sense. That's the way you deal with big issues like health care and taxes. And as we have said, we are ready to go with that as soon as we end the effort to jam this horrible bill through the Senate and harm the American people.
To just make one more point. and that is this. Well, given how unpopular the original bill was, how the heck does Leader McConnell hope to get this bill, which is virtually the same thing in so many ways, through the Senate? Not on the merits, but on political muscle. For the sake of the American people, I hope that political muscle fails. Questions?
Senator Schumer, you said something earlier about it's no wonder Republicans don't want to go home, alluding to them delaying their recess. A lot of conservatives say we don't need a recess, a summer vacation. Could you just explain what actually happens during this work period and who is the real loser in this situation?
Well, we don't know what's going to happen. I mean, Leader McConnell needed something. His bill was so unpopular, he needed a sort of shiny object to divert attention, so he said we're going to stay here for 2 more weeks. The problem, though, is not the amount of time. They've had 6 months in this session of Congress and 7 years since Obamacare passed to come up with a replacement. They haven't been able to. It's not time, it's the substance of what they want. So we'll see what happens. If the motion to proceed fails, I would urge them not to try again and tweak it again, but to work with us to improve the existing law. Other questions? Taylor.
Well, I was going to ask you about the appropriations thing you spoke on the floor earlier.
Yeah, okay, let me just be brief. You know, our Republican colleagues and the president seem to be almost wanting a shutdown when they call for a shutdown in September, which the president did, when they dramatically slash job-creating spending on things like education and transportation, try to hurt our safety net, Medicare, Medicaid. They're almost looking to shut down the government because what they're doing is so unreasonable, and they've said they wanted it in the past. We sent our Republican colleagues 3 principles. 1, make sure that we don't go to sequestration levels, which are dramatic cuts. 2, make sure there's parity between defense and job-creating non-defense programs. And 3, no poison pills, like the wall, which they seem to put in the House bill. So I worry that they almost want to shut down. We're going to do everything we can to stop it.
Well, how would you characterize the communication between your office and McConnell's office?
My office and McConnell's office are communicating well. I think the problem is between the Senate and the House. Yes.
Something a little parochial. The FAFSA-Collins amendment on
It's New York.
Medicaid is in this latest iteration.
Yeah.
Is that something that you want to see out of any
Look,
bill
it's
that comes forward?
it's rearranging deck chairs on the Titanic. They're pointing fingers at who should burnish the most of the Medicaid cuts. We say don't make the Medicaid cuts. Any other questions? Okay, thank you very much, everybody.